I'm Bobbi Fisher, and this is my Aesthetically Awkward podcast, a show where we dive into all things aesthetics, health, wellness, entrepreneurship, and everything in between. This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult your own healthcare provider before making any decisions in your personal health journey. Now let's get into it. Welcome back to the second episode of our second season of the podcast. Katie is joining me today for this episode, and we're going to chat a little bit about laser hair removal and how to prep for it, what to do in between treatments, a little bit more about the technology that we're using here in our clinic. Before we get into our core chat, we're going to go behind the mic for a flex or flop. I'm going to let Katie share. So Katie, what is something that has gone well in life, or maybe something that's gone sideways and taught you a lesson recently?
Nothing's gone sideways, knock on wood. Well,
we love that.
Yeah. My kids have been sick, but they're healthy now. So I wouldn't say that's a flop because they're fine now. But I just finished my second term of grad school with A's. Yay. So that's a flex.
Congratulations.
Thank you.
Do you have a break in between your courses?
Week. So I start back up this Wednesday.
Okay.
Yeah.
Well, hopefully you had a little bit of time to reset. Yeah. And what's the next course?
I couldn't even tell you. I don't even know. I haven't looked forward to it yet.
Right now, you're just doing a lot of writing.
Lots of research papers, lots of theory.
Discussion
APA,
board posts and stuff like that. So just preparing for all of that graduate level research that you'll have to be doing here soon. So.
Nothing interesting quite yet.
When do your clinicals start? Is it this fall?
Should be this fall.
Okay, well, plenty of time to prepare for that. You can enjoy the summer. Work on your papers and your posts of an evening and spend all the time you can with your kiddos until clinical starts
Exactly. That's the plan.
Right. Well, let's get into our core chat about laser hair removal. What does your typical consultation look like?
I want to know what area they want to treat, of course. I kind of want to know what they know about it. I do have some people come into it and think one session they're going to be bald in whatever area they want to treat, and that's just not the case. So I like to be really upfront about expectations, talk about how many sessions that they may need. I usually say 8 at least. I know we've talked about 6 to 12 during trainings and whatnot, but I definitely say at least 8, maybe 10, depending on how large the area. If you've ever been waxed in the area before, there's many different factors that go into it. And I like to see what their goal is. I have some clients who've reached out lately who want to have most of their hair removed by summertime. Now's the time to start, if not way earlier, because it does take that many sessions spread out 4 to 6 weeks apart. So it's not instantaneous. So let's talk about goals, area, expectations, and then some post-care too. There's no true downtime, I wouldn't say, but just kind of what to expect as far as sensation and healing process.
Like you had mentioned, whether or not they have that thought process in their head, one session is going to be it's going to clear them. I think a lot of people have maybe experienced a wax in the past. So they have that immediate smooth sensation, and then they have the outgrowth period. They have to return in 6 to 8 weeks. They have that expectation it's going to be similar, and it is not the case. Your hair doesn't just immediately fall out and then never grow again.
Right.
We're only treating the hair that is actively in the growth phase at that time, and you're covered in thousands, if not hundreds of thousands or millions of hair follicles, and you're only capturing a certain percentage of those in the growth phase during that particular treatment cycle. So those realistic expectations are probably the most important factor that goes into a consultation, so people know what they're in for. And then maybe doing a little spot test to make sure it's a sensation they're going to be able to return for, because if they have to come back every, let's say, 5 weeks, or anywhere from 6 to 12 months to achieve a good reduction in hair growth, is that an area that they're actually going to be able to tolerate that sensation?
Right. It's definitely a commitment.
Mm-hmm. Yeah. And the device matters too. The settings matter. Devices are not all created equally. So you definitely need to make sure, maybe do a consultation in a few different places with different technology and see what's going to be best for you.
Right. And some people might be a candidate for waxing. I mean, that might fit their goal better. So you just have to talk about timeline, expectations, and what they're willing to commit to, for sure.
No, I like that. We do offer waxing in our clinic as well. Obviously, the nurses aren't doing that, the estheticians are, but we do have options available.
Yes.
So when somebody comes in, what do you tell them as far as shaving is concerned?
I prefer them to shave the day before. I've had patients who come in who are doing face, maybe like upper lip area, that I will offer to have them shave here in the clinic. We do keep the little razors here, but I just think it's more comfortable if they have shaved the day before. Sometimes just having that, I guess it would be considered raw skin, does get a little bit irritated with the laser device. If you are shaving right before, we are using, cleaner and disinfectant to clean the area before treatment. I feel like it gets maybe a little bit raw, a little bit more irritated. So I like for it to be shaved the day before. I have had new patients come in who have wanted legs and arms done and haven't shaved in weeks, and I've had to turn them away and reschedule just for comfort measures and for the best treatment. I think that at least the day before, if not the morning of treatment, and should shave the area.
We try to make sure that that is clearly disclosed when people are calling in to schedule their consultations, or when we are making our outbound reminder calls in our pre-treatment instructions. We say it's ideal that you shave 12 to 24 hours in advance of your appointment. Mm-hmm. To Katie's point, the issue is the sensitivity. If you shave the day of or immediately before a treatment, when you come in, your skin may potentially be sensitive. Maybe you give yourself a little bit of razor burn, or you've opened up that follicle, taken off that top layer of skin with an exfoliation, because that's what shaving does. And then we are taking 70% alcohol and we are cleaning off the skin. It's going to sting. Mm-hmm. So then we are already increasing the sensitivity, increasing the irritation, and then we're taking a laser over that. That is just a little too much irritation, and if you have very sensitive skin, it's going to increase your risk of an adverse outcome. Rule of thumb is about 12 to 24 hours in advance. If you're coming in at 4 or 5 o'clock at night, then shaving that morning, you're probably going to be good. But immediately before the appointment, I do not recommend either. It would be better for you to shave the night before. A tiny bit of stubble is okay. We're talking like 1 to 2 millimeters max of outgrowth. That is fine. And if we need to take a razor and clean it up in areas, we certainly can. But we don't want to irritate your skin. Something else to keep in mind is you don't want to wax, you don't want to pluck, no depilatory creams or anything of that nature before your appointment. And why is that, Katie?
We want to damage the hair follicle. So if it's not there, just from plucking gets pretty deep. So if you're removing those hairs, we can't attack it. So I have a lot of clients who will come in we talk about laser hair removal during other treatments and whatnot, and they're like, I have these pesky chin hairs, I've been plucking them, and I'm like, well, let them grow. Yeah. Shaving's fine, use whatever gentle razor you have for your face, but we want the hair follicles to be there so we can damage it so it'll stop growing. That's the whole point.
So we need melanin within the hair follicle for the laser to work, or we are wasting your time and we're wasting your money. And I don't want to do that. We want to be as honest and transparent as possible about how to get you an effective treatment. So the lasers that we use, you need to have dark or ideally coarse hair. So white hair, gray hair, blonde hair, really light red hair, it's not going to be ideal. There's not enough melanin in that hair to absorb the energy from the laser. And like Katie had mentioned, you need to have hair actively growing within the follicle for this to work. It needs to be shaved, at or just above the level of the skin, but it cannot be ripped out of the follicle. And the reason is because the melanin that is within the hair, within the follicle, is absorbing the energy from the laser, and that is going to help us target the blood supply to that follicle, hence damaging the follicle, and it's permanent reduction of hair growth that is going to be happening. But if you don't have any melanin within the follicle, you're not going to get an effective treatment. And again, we'll be wasting your time, we'll be wasting your money, and we do not want to do that. So no plucking, no depilatory creams, no waxing. I'd say for at least 4 weeks, if not longer, before your treatment, because we want to make sure as many hair follicles as possible are captured within your treatment window. So at least a month before you plan on coming in for a consultation and doing your first session of laser hair removal, stop everything else. You can shave as much as you want leading up to your treatment and in between treatments. You might be sensitive for a couple days, so you might skip shaving for 2 or 3 days after laser hair removal, but between cycles, shave as much as you want. There is no restriction on that. Let's chat about sun exposure and spray tans. What do you tell your patients during your consultations?
Definitely always stay out of direct sun exposure without SPF 50, always. As far as I think it's really good to educate patients on the fake tanning, I don't even know, I've never used them. What do people use?
Like the spray tans or the Jergens lotions or the drops. There's so many different like tinted body oils and things of that nature.
Yes, that is still considered tan skin, and it's because we are going to have to treat that skin at your skin color when you come in when you're tan. So definitely try to be at your baseline skin type, because if you do have an active tan, whether that be a fake tan or you've been in the sun, we have to treat it based according to how you come in. So a more gentle setting, not as aggressive, meaning it's going to take longer to get that hair reduction. We're going to have to not be aggressive that we would with your baseline skin color. So definitely stay out of direct sun exposure, wear your SPF, lay off the self-tanners, come in as you so we can treat honestly and have an effective treatment and maybe have that hair clearance maybe sooner than the 8 weeks that's predicted.
And the technology that we use in our clinic, it's safe and FDA indicated on all skin tones and types. So very fair skin all the way up to the darkest skin, we can treat you safely. When you have an active tan, and when I say active tan, I mean you've been out in the sun, soaking up the rays, poolside or out on the boats, intentionally laying out or getting into a tanning bed, that's an active tan. It increases your risk of an adverse event. It is increasing your sensitivity to the laser. It's increasing your risk for burns. We are going to have to adjust the settings and treat you with a setting that would otherwise not be effective for your baseline skin tone or type. So you're going to increase the number of times you have to come back to clinic for treatment anyway. So it's just a better idea if you skip sun exposure altogether. If you're somebody who absolutely cannot stay out of the sun during the summer months, wait and do this during the fall and the winter. Okay. Mm-hmm. And then as far as spray tans are concerned, when you're doing that, you're putting fake pigment on your skin, and that pigment is going to absorb the laser energy and you are going to get burned. So no spray tans, no self-tanning drops, lotions, creams, anything like that for at least 2 weeks. If you're coming in and I can see a baseline like orange tone on your skin, or if I'm scrubbing and I keep like looking at the wipe and I see like an orange or a brown coming off, if I cannot get all of that off, you're not getting treated. You're going to be rescheduled in at least 2 weeks. I'm going to tell you between now and then, no fake baking. I'm sorry. You cannot do a spray tan. You can't do any lotions, because if you do that, I'm potentially going to injure you. And that's my license. And it's your safety. It's so important. We don't want to cause permanent damage, scars, or anything of that nature because we didn't properly educate you. So just some food for thought there. And maybe at least while you're going to be doing laser hair removal, you just embrace your natural skin tone, and then you can go back to the spray tans if that is your preference after you're done with your series. Do you see a lot of people coming in with like full face of makeup, lotions, anything like that? And what do you tell your patients?
Sometimes, like if they're getting off work or something like that, understand. But usually, like you mentioned earlier, with our reminder calls for appointments, we go over how we want you to come, clean, bare skin. If they do have makeup on, we have things here we have the very gentle wipes, we have wound cleanser, and we have the 70% alcohol that we will cleanse and disinfect with beforehand. It's best to come in with clean skin though, free of moisturizers, free of anything. Of course, you can come in with your SPF on, we'll take that off, but we're going to take it all off anyways. So it is best if you come in, if you're treating your face per se, without a full face of makeup, because we don't want to scrub and scrub and scrub, and then your face is already irritated, and then we're putting a laser on it, and then all the things. So it's best if you come in just with a bare face, bare skin.
And that's the biggest thing right there. We may have all the things that we need to remove that makeup, but by the time we get it all off, especially if you've got a little bit more than like a tinted moisturizer or an SPF on, if you've done like a full beat of bronzer, contour, foundation, and you've used a setting spray and we're having to really get aggressive just to get that off, your skin's going to be red, raw, and irritated. And then we throw alcohol on top of it to degrease and disinfect before we go in and do the treatment. You are going to be so sensitive, and it increases your risk of like a post-inflammatory reaction as well. So preferably come in with clean skin so you can get the safest, most effective treatment. How about changes in like health status or medications, Katie?
When anyone comes into the clinic, whether it's their first time or their 10th time, we go over any changes of medication, if they've had any hospitalizations recently, any recent surgeries, any of the things. If they are on an antibiotic actively, I'm definitely going to run and ask you if it's okay, depending on what antibiotic they're taking. If you're on Accutane, it's going to be a no. That's for a lot of different treatments here. But I would definitely double check with you. I mean, what antibiotics would be a contraindication for laser treatment?
The biggest drug class that we are concerned about when it comes to antibiotics for increasing skin sensitivity is the tetracyclines. It doesn't mean that they have to be turned away for treatment, but we might need to do a little spot test to gauge their sensitivity, because some people will not be able to tolerate it. But there are other people who are on doxycycline chronically for acne, let's say with dermatology. I've done a spot test, they've been just fine, and they've gone through a complete treatment cycle without any issues. So it definitely is going to vary for each individual, but that's why it's important to communicate, because maybe you are a little more sensitive and we need to take it down a notch, particularly over like highly sun exposed areas if we're doing a face, but maybe your underarms, you don't really have any sensitivity there. So we can definitely flex around and adjust your settings to make that treatment as safe and comfortable as possible for you. Like you had mentioned, Accutane's an absolute no. Most laser hair removal companies will say that you need to be off of Accutane for at least 6 months. My rule of thumb is 12 months. And the reason why is because it completely dries you out and it destroys your skin barrier. It does a lot of good for people who have cystic nodules, who are non-refractory or do not respond to other medications. You've exhausted all orals, all topicals, and you've just had no results. I've seen Accutane be life-changing. But what it does to the skin barrier afterwards, that takes a long time for you to bounce back and heal. So laser hair removal is not going to be for you. And it doesn't matter if it's your face, your legs, your underarms, a bikini, does not matter. You need to be off of that therapy for at least 12 months before we're going to touch you with a laser, microneedling, chemical peels, anything that is going to impair your skin barrier. What about tretinoins or alpha-ret serums, things of that nature?
I would stay clear of the actives for at least a couple days after if you're doing facial laser hair removal, of course. As far as sensation though, I mean, you should feel pretty baseline next day. Maybe a little bit of itchiness. It almost feels like that sunburn itch that you have after being out in the sun, but really you should feel pretty normal the next day. But just to keep your skin barrier safe, I'd lay off any actives, the retinoids, the tretinoin, any of the AHA, BHAs, just for a couple of days at least to give your skin a little bit of a breather. And then once your skin feels okay, you'll know it won't be tender to touch. It won't have any maybe redness, or sometimes you do get a little bit of, I don't want to say welts. What's the word I'm looking for?
Like almost like a perifollicular edema or like folliculitis afterwards.
Right. You may see that day 1, day 2 after, but after that you'll know when your skin's healed, and then I feel comfortable with you restarting any of those active ingredients.
The actives, you want to skip a couple days before too. Like if you're using something like the Alpha-Ret by Skin Better Science, it's super gentle. It's like a hydrating retinol. So 24 to 48 hours before holding that, I'm good. But if you're on more of a heavy hitter like tretinoin, you need to be skipping that at least 3 days, depending on how sensitive your skin is. I might have you hold it 5 to 7 days prior to coming in for a laser. So that's definitely important to have that conversation with your provider and try to stay with the same provider so they're very familiar with your regimen and they can make sure that they are following up with you at every single treatment so you don't have a potential adverse outcome. And like Katie had mentioned, after treatment, you're going to need to skip those actives and any exfoliation for at least a couple of days until your skin is returned to baseline. For some people, 24 hours later, you can't tell you had anything done, you're good to go. Other people, you might be a little more sensitive and you need to skip it for a few days after. And it's not just the face where we're seeing actives being used. Some people, at least who come to see us for like body acne treatments, we have the Mandelic Face and Body Wash by Face Reality or the Alpha-Ret Body Treatment. Those have actives in them, and that might increase your sensitivity if you're doing underarms or legs too. So make sure that you're looking at the ingredients in all of your topicals, whether it's face or body. As far as sensation with laser hair removal, how do you describe it during your consultation to a patient who's never had hair removal in the past?
I wouldn't describe it as painful. I think it gets warm as the treatment goes on, and I would say like maybe like a jolt feeling almost. We want you to feel it because we want it to be effective. So if you're not feeling it, then we will, crank it up a little bit. But I don't think it's painful. I think it just can get warm. And in those sensitive areas like bikini, if we're doing Brazilian, doing the 4 to 6 passes, it's gonna, I'd say, be a little spicy, but not like jumping out of the chair painful. So I'm curious to see like what the new laser is going to feel like versus the one now, because we have the chilling tip on the one now, so that kind of acts as, I wouldn't say a numbing agent, but it makes it more comfortable, and I appreciate that. So I'm excited to see how the new one feels.
So as far as sensation, it should be similar, although, of course, if you speak to the manufacturer, they say that because it's quicker, it's even more comfortable. But you should feel something. I call it almost like a stingle. So like a hot pins and needles, like prickly sensation. If you feel nothing, you're probably not getting an effective treatment. It probably means that the pulse width or the repetition rate or the fluence or the amount of power or energy that's being delivered into the skin needs to be adjusted, because you want the blood supply to the hair follicle to be collapsing. You want it to be damaged. So if you don't feel anything, you're probably not getting that effective clinical endpoint. You're going to need several more passes before you see that perifollicular edema or the swelling within the hair follicle. So you definitely want to make sure during your initial consultation and your first treatment that your provider is gauging your clinical response, that they're asking you, hey, what does that sensation feel like? And that they're taking the time to push pause on the laser, take off their goggles, and actually visualize the skin to make sure they're getting that almost like chicken skin appearance. That's what we want. The differences between the laser, like Katie had mentioned, we're using gel as a glide, and the current laser, the system that we use, has a water chilled technology. So it almost feels like an ice cube gliding over the skin. It's going to be similar with our new laser, with the exception of there's absolutely no gel, but the tip of the laser is still going to be water chilled. With touch, it's going to be cool. And then we can also blow cold air with our Zimmer chiller at the same time because it modulates in. So we'll have 2 different methods of cooling the skin. Keeping in mind, with lighter skin types in particular, to get an effective treatment, we don't want to overcool the skin. With darker skin types, we do want to chill the skin a little bit more to help protect the melanin. So there are some nuances there. Again, why it's important to go to somebody who understands the technology and understands the wavelength, what's happening in the hair follicle, and how to adjust the settings to make sure that your treatment is individualized and so you get an effective treatment.
I think without the gel too, it'll be nice to be able to visualize the skin right after, because sometimes I mean on a new patient,
you're having to scrape the gel off.
Yes, just to see, is it red? Am I getting tissue response? And even like doing bilateral armpits, one side can be more sensitive to the other. So I'm spot testing everywhere. It doesn't matter if it's the same body, it's different. So I'm excited to not have that gel to mess with.
Yes, it's going to make it so much quicker. And right now, your first treatment is always going to be the longest because that gives us our baseline settings. After your first session, we record those settings, and that's what we use the next time you come in. We'll do a little spot test to make sure that your tissue responds as expected before we go ahead and knock it out. But your second session and subsequent sessions thereafter are always going to be your quickest. But your first session, it's best to do it under the aesthetics consultation. That's how you book it with us, because we block out an hour, and it gives your provider more time to talk about all the clinical nuances and to do those spot tests to make sure that we can get you a safe, effective treatment that's also going to be comfortable, but actually get you the type of treatment that you want, because we don't want to waste your time, and we want to make sure that's a sensation that you can continue to come back each month thereafter to experience again. Because if you're going to be dedicated for every 5 weeks, anywhere between 6 to 12 months, you're going to want to make sure it's a sensation you can tolerate. This is a great time to soft launch that we are upgrading our device here in clinic. So we had been previously using the Roar Aesthetics Epilase and the 810 nanometer diode on our Spectrum laser, which are excellent devices, and they served us well these last few years. But we are upgrading to the Echo laser hair removal device. It's a fiber diode technology by Quanta Systems, which is Italian. To kind of compare and contrast them, the Roar would be like using a Ford, and the Quanta is like driving a Ferrari. So it's a really nice system. It's wonderful. I'm so excited about it. We are the first in Illinois. We're the first in Illinois with the Quanta Systems technology. So, yeah, that is something to be very excited about. I am so excited to take this little Ferrari for a test drive.
And she's cute.
Too. It's on brand, pink, purple, black. Yes. It's gorgeous. It's going to be game changing for you girls because there's no gel. So talk about the experience of like coming in to try to do a full leg or even a bikini with gel, how messy that gets.
It's lengthy just because I don't like to slap the gel like on a full leg. I section it off. We do legs into fours, even bikini. We do one side, the other side, flip over. It gets messy. Mm-hmm. It does. That's why our appointments are longer. I mean, if we're doing a full body, it's a couple hour long appointment. So this is going to be really nice as far as appointment length time. It should cut down a lot of the time of, wiping off the gel and then flopping sides and then applying more gel and making sure there's enough gel to glide and to be effective. This should really be great. I'm very excited.
It's going to be amazing for the patients and for all of you girls that are actually doing the treatments. The handpiece itself isn't going to be as heavy, so ergonomically speaking, that's going to be wonderful for you. It's not going to be such an upper body workout. When you are treating like a full leg and you're doing the front, you have to take that like extra 5 minutes or so to just clean off all the gel so they can flip over, because if not, it's getting all over like the paper covering on the chair. It's getting in the creases of the chair. It will create such a mess if you don't do a good job of cleaning while the patient is rotating on the chair. So we are eliminating that issue entirely, cutting treatment times in half, if not even more so. I believe like a man's back we can do in about 8 minutes, which in the past doing a full back has taken me like 30 plus minutes, depending on like if we're like doing the sides too, the top of the shoulders, if I'm having to have somebody rotate. So this is game changing for anybody who is actually operating the laser. It's amazing for the patients because we don't have to take 2 hours of your day for you to come in and do your face, your underarms, your bikini, and your laser hair removal on your legs. It's going to take about 45 minutes to do all of those areas now. So phenomenal.
That's so exciting.
Yeah. No gel. It's got its own like water chilled systems. It's a cool touch technology, and we can also pair it with our Zimmer. It connects to the device so we can chill as we go as well. We are going to be launching that device. It's already here. We are waiting for our training date to get scheduled, and then that will probably be up and going, I imagine within the first week of April or so. So definitely, if you are interested in laser hair removal, now is the time to get in, get your consult, and get on the books. The girls usually schedule at least 2 weeks out or so, so you definitely want to make sure you pre-book. If you have been putting laser hair removal off because you were worried about price, you were worried about discomfort, you thought maybe that you didn't have the right skin tone or type for this particular treatment, we want you to rest assured that we have a system that is safe for you, that is going to be potentially comfortable for you. Come in for a consultation. There is no commitment to purchasing a package up front. Come in for a consult, do a spot test, feel the laser for yourself, and then you can make that informed decision with the guidance of your provider to decide if laser hair removal is something that you want to commit to. And if it's not, we'll help you get booked with one of our estheticians to get a wax. All right, guys, we will see you again next week on the Aesthetically Awkward podcast.